Hello, Mate to Thrive Nation. It's all going to be about your kids, teenagers, adolescents with a pediatrician. He's an author, and it's a privilege to have Dr. Gator on the show. So welcome.
Thank you so much for having me.
Brilliant. I love your Instagram page, and you've just done so much work to educate. And it's been a privilege to sort of see someone with a courageous calling like you, who's an integrative pediatrician, who's written a book called Parenting at Your Child's Pace. I just want to get that exactly right. And so, yeah, just tell us a little bit about your background and how you got into integrative functional medicine. And it's just so unique because I've just dealt with physicians for 25 years. I've been a physician for 25 years. And it's just not a normal thing for, pediatricians to go into functional and integrative medicine.
Yeah, I mean, I wish it was more normal. I mean, hopefully it's the message is getting out there. But yeah, I mean, for me, I did all the regular training. I grew up pretty normally, I guess. And as I went through the Western allopathic, regular medical training, I went to a great program, but I just got frustrated. I really got frustrated with the quick visits, the medications for everything. Giving out antibiotics like it was candy. And I also met my wife, my now wife, during residency, and she's very holistic minded too. So it really did open up my eyes a lot more. And I've always been a curious person, and certainly seeing patients, friends, family members within the regular system go outside of it and get better. And just wondering like what's that about? Like, why is somebody going to their doctor being told they have this condition forever, all these medications they need to be on, and then they go to some woo-woo naturopathic whatever, right, and get better. And it's like, okay, well, maybe there's more to that, right? And then the more that you start to learn about it, the more that you realize that it's not very woo-woo at all. There's a lot of amazing modalities out there that are used all over the world. And if you start to think about the root cause, then maybe you can get to the reason of why something's happening to a patient. And you can actually fix things, improve things, get rid of their condition. Just think about it in a different way. So once you, I think, step outside, you don't go back. If you're open-minded, and that's really what got me here today, is just being open-minded and seeing that it's very obvious that we should be thinking about why, we should be thinking about the root cause, and there's no reason not to. It's not crazy woo-woo at all. I mean, you can't, there are things that can get way out there, but most of it is not, right? Most of it is very common sense.
No, but I mean, it's to be open-minded. I remember when I was in medical school, they shut the door on sort of being curious and open-minded to natural medicine and Chinese medicine, and that it sort of wasn't seen in a great light. But I'm really happy for someone like yourself who's done it. I've got a 20-year-old, and then we had a 10-year infertility journey that was really tough, and I've got an 8-year-old now, incredible through IVF and that. But it's been harder, much harder to parent my 8-year-old. The Gen Alpha versus the Gen Z generation. Just tell us what's happening with the rates of disease. If you've got statistics, we do a lot of mental health and mental performance with our tribe and our community. And I've just seen, children get sicker and sicker far quicker. The rates of chronic disease for children and adolescents and teenagers just exponentially increasing. I'm for the first time, and I say this openly, seeing a counselor, seeing a psychologist because of compassion fatigue over 25 years, which has been helpful. But just tell us about the real rates of chronic disease in children and then adolescents and then teenagers.
Yeah, it's scary and it's staggering how bad it is. I mean, you look at the numbers, and I'm talking American numbers here, but 50% of kids have a chronic disease, which is just absolutely insane. Like, it used to be 1 to 5%, maybe 50 years ago, and now it's 50%. 1/3 of children have pre-diabetes or diabetes. You never used to see type 2 diabetes in kids. I mean, it was literally called adult onset diabetes. You can't really find a case of it, as far as I could tell, 50 years ago or more. And now, you're seeing kids as young as 10, 15, 13, having type 2 diabetes. You see mental health concerns through the roof. I mean, depression, 7 to 10%, anxiety, 7 to 10%, mental health diagnoses. So 50% of kids, by the time they're 18, have a mental health diagnosis in America. I mean, that's insane. 1/3 of teen girls think about suicide, or have thought of suicide. Like, those numbers should not be like that. I mean, you look at autism, right? Autism, when I was born, maybe 1 in 2,500, in that range. Then maybe 1 in 100 or 1 in 250 20 years ago. Now it's 1 in 36, 1 in 22 in California. Neurodevelopmental disorders, 1 in 6. So, not just autism, but if you combine everything, that's a neurodevelopment. 1 in 6 kids have a neurodevelopmental disorder. So it's almost everybody has something at this point, which is beyond ridiculous. Like it's we have to notice this. I mean, we hear all the time, and it's so frustrating. Like, oh, it's genetics. Oh, we're better at diagnosis. That's BS. Like, it's such BS. You just look around and you see the kids, you see them at the playground, you see them at the school. It was not like that when we were growing up. I don't remember most of these things. I mean, I don't really remember allergies. People had seasonal allergies, but peanut allergies were not everywhere. Food allergies were not everywhere. They certainly existed, but not every other kid. Autism, I don't remember anybody with that when I was younger. I'm sure there were some, but not like it is today. So something's going on. Many things are going on, and we need to get real about this, and we need to make some changes so that way this doesn't continue.
And when you say, I mean, 50% of kids have a chronic disease, is that anyone under the age of 18? Is that what you're saying, kids or children?
Yeah, so I mean, there's different statistics depending on where you look at it. I've seen 40%, I've seen 60%, 50% kind of seems like in the middle somewhere. But yeah, usually the studies are like in kids up to 18 years old. So yeah, I mean, kids, teens, it's pretty staggering.
Yeah, it is. And I mean, I think we've got to know that the extent of the problem, because I don't think people do know the extent of the problem. Maybe something like ADDH, attention deficit disorder with hyperactivity. And do you know those stats? Because I've just seen people, kids' inability to focus. And I look at my daughter's class of 19, I think about 80-90% are either getting speech therapy, physical therapy, or occupational therapy, or they're seeing a school educational psychologist. But maybe just sort of let us know a little bit about those, because I know those are often moms and pops that come into my office here, my room, saying, listen, my kid's on Ritalin and they're really struggling with focus and they're really battling mentally.
Yeah, that is one of the diagnoses under the neurodevelopmental disorder. So I mean, it's 1 in 6 if you include everything. I don't know the ADHD number specifically. I've seen like 10 to 25%, but the numbers, whatever it is, they just keep going up. The prescriptions for ADHD medications keep going up. I mean, it's way too high, whatever it is. And ADHD, I think, is a hard one because it's a diagnosis where you could just have some inattentiveness. Maybe the school system's not perfectly set up for you, and it's really easy to go to the doctor and these days just get that diagnosis and then lump it in. So I think the numbers are going up a lot, but also there's just a way over diagnosis of ADHD as well. And I think that's a problem also. So like, I think you get both sides, but whatever number you look at, whatever study you look at, wherever you look, everything's on a trajectory going upwards. And so I don't know if the numbers matter so much as the fact that it's insane and going in the wrong direction, and we need to do something about it.
Oh, great. And look, I do think some people are numbers orientated with their personality. We've done a lot of personality profiling here at Made to Thrive for many years, and some people need to know the stats, or some people don't want to know the stats. So I think knowing them, I think, is important as a pediatrician and putting them out there. But it is exponentially increasing, whichever way you look at it. Now, if we look at your functional medicine doc as well, if you look at root cause diseases of these chronic diseases, and maybe the top ones, is it neurodevelopmental? So 1 in 6. So, what is that percentage wise? You probably can let me know that exactly. What's it?
Yeah, like around 20%,
20%,
like 50.
1 in 5. Okay. So 20%.
Yeah. So,
Yeah, go for it.
I was just gonna say, when I looked at those stats, and there's a couple of different studies, but the best ones I've seen showed around like 17%. So usually people say 1 in 5 to 1 in 6. And the best ADHD studies that I've seen say around like 11% for ADHD. So there, it depends on what you read and which study, but again, it's like, that's a lot.
Yeah, no,
1 in 10 kids have ADHD diagnosis. Is so many, whether it's 8% or 13%, does it really matter? I mean, it's way too much.
I think the biggest stat is 50%. I'm going to say this again, 50% of kids have a chronic disease. I mean, that is just, I don't know it's like scary, very, very scary. And if you look at those, what do you think are the big sort of bastions and pillars or root causes of all these chronic diseases in kids?
I think the big ones are our food and the toxins. I think we have really shitty food these days, and we don't get the nutrients that we need. And the food is filled with chemicals and toxins, and a lot of the food that kids are eating isn't even really real food. It's ultra processed food that's devoid of all of the nutrients and filled with chemicals and preservatives. And then you add that with our daily lifestyle that we're exposed to so many chemicals, so many toxins. We're not moving. We're not getting outside. We're not in nature anymore like we used to. So we're basically living in a way that we were never intended to, certainly not recently. I mean, we can adapt and change, but we haven't changed that much in 50 or 100 years. But the world has changed so much. And I just don't think that we're built for the way that we're living. I mean, we're meant to be outside. We're meant to be moving. We're meant to get sunlight. We're meant to eat fresh local produce that we just picked. We're meant to eat, if you're going to eat animals, like something that you just killed, not something that was killed, a year ago. Or when you're eating a fruit, it's not like it was supposed to be picked 3 weeks ago, shipped across the world, sprayed in a bunch of chemicals, and then you ate it. You're supposed to eat it right off the tree or the bush. And we're not doing that anymore. So we're not getting the nutrients that we're supposed to be getting. And then you mix that in with the chemicals and the toxins. And how would you expect your body to function? We're built of what we eat. And if we're not giving it what it needs, then there's no way we're going to be healthy.
I got you in those. I want to go in a deep dive there, but possibly does it start with the parents? If you look at their lifestyles, what they're eating, all the processed and ultra processed foods that they're eating. And so the kids just model that, and it's easier for the parents now, not to eat real wholesome, nutrient dense food and take the time to cook together and take the time to spend together, teaching. Because, if you're not eating well, you're grossly overweight, you've got a chronic disease. It almost seems that now you're not going to raise your kids in any other way. And to say, listen, you can't have that Pop Tart, you can't have that junk food. So we're going to pass McDonald's. I'm going to get that, but then you're going to eat the salad. Does it start with the parents?
Well, for sure. I mean, there's no question for kids that you have to practice what you preach, and you can't expect them to eat healthy or get moving or do any of those things if you're not doing it yourself. So in general, it starts with us. We have to take that initiative. We have to make it a family ordeal, and really just have the discussion if the kids are old and say, like, we want to be healthier, we're going to do this, and we're going to buy healthier food. Just don't have the crappy food in your home anymore. Try to prepare more meals, eat together, cook together. I mean, these are all things that we can do that everybody used to do, and we just moved away from that through marketing. And it's like, faster, cheaper, easier. Everybody's both parents work in most households now, so that's just something that we've moved to. But we've moved away from the importance of cooking, the importance of fresh food, the importance of taking time, and a healthy meal takes time. I mean, it just does. You just can't make it in a way that it's mass produced and just ready for you without losing something. I mean, it's fine. There's a place for everything, and we'd all need to have calories and nutrients, but there's a big difference between something you just picked and prepared yourself versus something that's not. And so we have to make the decision of what we're going to prioritize moving forward. And we've been marketed to and lied to, and really just pushed away from what we know as common sense, basic health. And we have to get back to that however we can. It's not easy. I mean, it's really hard to find good, fresh, healthy food. I mean, it just doesn't exist in a lot of places, or it's very hard to find. So I think as a parent, it's really important to prioritize that and figure out what are the ways that you can eat a little healthier. What are the ways that you can find some fresh food? Can you go to a farmer's market? Can you order directly from a farm? Can you make a garden and plant some stuff yourself? Whatever you could do. I mean, it doesn't have to be everything, right? And I think that's the big key. A lot of times is it can be really overwhelming for parents, because they're like, well, what am I supposed to do? And the reality is, you just, whatever you can do, kind of move one step forward at a time. If you're buying a lot of packaged foods, maybe buy a little bit less. If you're cooking once a week, cook twice a week. If you're buying, mostly from a place that's not organic, get a few things organic. Try to go to a farmer's market. Try to buy a farm box. Like, whatever you can do, every little bit helps, because your body is amazing and it can detoxify, but there's only so much that it can do.
Yeah, incremental steps, and there's no sort of shame and fat shaming people and guilt involved in this. We want to empower people to make small steps in the right direction. So I really like that, Dr. Gator. I think there's a lot.
I think that's a really good point. I want to talk about that, because like the shaming is really important. I think that's a big part of the media, right? It's like, one of the big things that has happened is, if you talk about health as a doctor, especially weight, obesity, it's like, oh, you're fat shaming people. Oh, no, it's not about that. It's about health. If a doctor can't talk about health, like if you're talking about smoking, are you lung shaming somebody for talking about cancer? It's like, no, you're telling them, like, smoke if you want to, you're allowed to, but like, you're going to increase your risk of cancer, right? Of lung cancer. Like, if you're going to eat in a certain way and you're going to be obese, you're going to increase your risk of dying, of diabetes, of cancer. Like, this is the facts, and we're trying to help prevent. It's not about shaming somebody. You can be amazing and beautiful and wonderful and have a good personality and all these things, but that doesn't mean that obesity is healthy. It's not. We know that there's nothing that should ever say otherwise. Of course it's not. And we're trying to promote health and helping to push people in a direction that promotes health, not to shame somebody, but to work to improve our metabolic health for our families and our kids, so that our kids don't have autoimmune diseases when they're 10, so that our kids don't have cancer when they're 15, because that's what's happening. And we need to move it in the other direction. Talking about obesity, like when I was born, again, in 1980s, 0 states in America had a obesity rate of 20%. None. Now, every single state has an obesity rate of 20%. That's in just 40 years, right? That is a huge difference. And you cannot say that's genetics. It's not genetics. That's environment. That's the food. That's what we're doing. And just like it's happened over a couple of decades, it can also be reversed. And not everything we do in medicine is horrible, right? We used to live till we were like 50 and 40 and everybody died. And then now we live longer. So we have a lot of good stuff in medicine, but we're also, life expectancy is going down again. Chronic disease rates are skyrocketing. It's not everything we're doing in medicine is great. So let's take some lessons from the past, learn from what we're doing well, learn from what we're not doing well, and let's find some balance somewhere in the middle, because there are a lot of things that we can do to decrease this chronic disease risk. These are simple things. They're not rocket science. It's focusing on food and movement and toxins, and not focusing more on medication. Like, we don't need more medicines. We need more exercise.
Yeah. No, I got you. And, I learned this in like recently in my podcast, that a lot of kids and teenagers and even adults are addicted to sugar. And this started in the 80s when big tobacco bought the 7 biggest food companies. And what they did is they put this addictive model into ultra processed food. So what is your suggestion when there's an addiction? Because now you've got sort of a biochemical addiction. We would never say to a heroin addict, listen, you know what, let your hair down with heroin on a Friday night and let your hair down on a Sunday lunch, which is what I do and we try and do with our family. We do our best, and I think we do well because we eat a lot of, 80% probably really, really healthy. But on a Friday night, I let go, and on a Sunday lunch, I let go. But if you're addicted, it would be like telling someone, you can have heroin on a Friday night and a Sunday, and then expect them to just wake up on Monday and say, okay, well, I don't need that substance, and now they're thinking about the whole time. Even my daughter, who's 8, it's far harder for us to raise her with healthy food and nutrients. And she's always the one left out, and she can't have this and she can't have that. And it's a tough one. So what do you say about this addiction model that I think has become far more prevalent than even when my son was 20?
Yeah, well, it's a very good point. And I do think that we need to be mindful of that. But at the same time, most people that are mindful of health can make that transition fairly easily. You do it over, not in one day. You don't necessarily have to throw away all the bags of chips. You just start to transition. You stop buying things that you don't want in the home and have better things in the home. If you want to buy chips, it doesn't have to be chips to broccoli, but you can look at the ingredient labels and buy a better bag of chips. Take your kids with you and try different things. You're not trying to deprive them. I think that's the key. Like, you're not depriving them and giving them bad tasting food. You're trying to find healthier versions of food that they like, and you start to replace things with new and better things. And you do transition over a bit of time, a month or 2 months or whatever it is. And I think that seems to work well. You start teaching them about it, you start talking about it. Hopefully they feel better with eating the better foods, and you do move towards that. We're not trying to say you can never have a piece of cake again, but at least at home, especially with kids where they're eating most of their food, you transition that food. You don't have the Oreo cookies around, so it's not a temptation. You have other snacks available, and they'll eat that. And just like anything, if it's not available, you're not going to do it. And once you transition out, that's fine. And if you're out at a party or something, okay, then that's where they get their chance to have a couple of snacks or whatever it is. And that seems to work well for most people. I mean, it's a part of parenting. I think it's parenting. We set boundaries. And if you want your kids to be healthy, they might not like it. They might not like it for a couple of weeks, but that's just parenting, and they'll get over it. And I think the key is to offer them good alternatives, right? You're not trying to say, okay, we're just eating steamed broccoli from now on. There are many, many, many great healthy options, or healthier options out there, that you can transition between really, really crappy food and mediocre food to really healthy food. So just work the transition and really start to do some research. And you don't have to have a PhD, but you can certainly read labels, right? And you buy things with real ingredients, and that's going to get you a long way.
So what do you think about taking a period of a week of not giving your kids any sugar or any treats or any refined carbohydrates? I mean, sugar and fruit and that is healthy. I'm talking about refined and processed and ultra processed carbohydrates, or taking 2 days a week. Is that an important adjustment with regards to just this dopamine? I mean, I just know with my daughter, even my son, it's like every day, okay, we say you can have one sweet thing, but then, the thing is every single day having a sweet thing or having something ultra processed or a biscuit or a cookie or something, I don't think is the best. Do you think there needs to be a couple of days a week or a week, a quarter, where you don't give them any of these ultra processed, things like gluten and glyphosate containing, wheat? So we had Stephanie Seneff on the podcast, and South Africa is the #1 user of glyphosate in the world, ahead of the US. We had Zach Bush on the podcast, same story. What do you think about that model to try and help people really sort of break I think it's an enslavement to sugar and ultra processed foods?
Yeah, well, I think the answer to that question is you have to do whatever works for your family, and you have to do the best that you can. Um, I don't think it's realistic to tell people everybody move to the mountains and go live off of a farm and you never eat this food again. Are you going to be healthier for it? Probably, right? I mean, probably that's the best, but that's not very realistic. Most people live in a city. They got to eat on the go. And so I think it's balancing that, minimizing as much as you can. Again, trying to purchase as minimal of this stuff as you can. I don't know that I would go from your kids eating really shitty sugary food every day to nothing in 1 week. But I think in the long run, that should be the goal. I mean, I don't think you need to have that food in your home at all, or very minimal of it. And I think that if everything that you have in your home is approved by you, like you're happy that they would eat it, then you're not really worried about what they're eating. They can have whatever snack and it's still fine. And I think that would be the goal overall. But in general, I would say by and large, for most people, like just start focusing on this as much as you can and do whatever you can. And if we can minimize to whatever degree what they're eating, that's a big step forward. And if we do that enough, then that's going to improve the health of our kids. So whatever you can do that. If you don't feel like you can take a week off of all sugar, then don't. But I don't think it should be, again, like, to me, taking 1 week off of sugar doesn't mean anything, right? This is a long-term thing, right? What does it matter if you do 1 week of a detox and then you go back to eating it the next week? Like that doesn't matter to me so much. To me, it's the long-term small amount that adds up over the long run. Like eating a piece of cake is not the end of the world, right? If you do it once, but if you're eating it every single day for 10 years, that to me is the issue. And that's what I think is going on with chronic disease. So I would focus more on what you can do realistically in the long term versus a detox for just 1 week, because we know that like diets and things like that just don't work, right? So if you're going to do it for 1 week and then they're going to go back, that's not helpful. Like it's better to set up your lifestyle for success, I think.
Cool. Great. Let's move on to toxins and let's talk about the soup study. I found that extremely, extremely interesting, because I think a lot of people are unaware of just toxicity and its role with regards to chronic disease.
Yeah, I love the soup study is such an interesting one, because it's a simple study, but it's so powerful in terms of the research. And so if you're not aware of it, so it's out of Harvard, and they gave a group of people canned soup for 5 days, and then they gave them homemade soup for 5 days, and they were looking at BPA in the urine. So the plastic lining that's on canned soup, most cans have BPA lining inside, and so they were looking at their urine. And from the 5 days where they ate the canned soup to the 5 days where they ate the homemade soup, the difference in the urine, the BPA, was 1,000%. A huge difference in just a couple of days. And why I think that study is so useful is because it makes you think, look, this is just 5 days. It's just a can of soup and it's just one chemical, but look at the difference of that choice over those 5 days. It's a huge difference. Now, how much of that actually stayed in your body, who knows? But the point is, it's such a big amount, such a big percentage difference. And if you add that up over a year, 5 years, 10 years, every other chemical that you're exposed to, like these little decisions matter and they add up. You're not going to, get some sort of chronic disease from 5 days of a little bit of BPA from a canned soup. But if you do that for 20 years, if you eat canned soup every single day, yeah, maybe that's going to affect you. Maybe it's going to be too much for your body and it's going to affect your liver or your kidneys or your heart or whatever. I don't know. I mean, who knows what it does to you, if that specific thing, but it's like, whatever it is, obviously not good for you. And so, yeah, these decisions matter. And that is where we have some control. And I think that's where it's so powerful in as a parent to really think about health when you're making decisions, especially when you're purchasing things, you're putting in your home, purchasing things you're putting in your body and in your kid's body, because these things add up and we can't control everything. Like we can't control the air that we breathe out there. We can't control the water in our taps, so much. So we do whatever we can to decrease those chemicals by maybe getting some plants or getting a water filter or reading the labels so you're decreasing something, or making more meals so you're not getting that BPA, because you're still going to be getting a bunch of chemicals. So whatever you can do to remove or reduce that gives your body the best chance to be successful, because there were chemicals 20 years ago, right? There's just more now, but people didn't have chronic disease like they had now. So obviously our bodies could handle what was going on 30 years ago much better than they can now. So if you can do that and reduce your family's load down to a manageable level, your kids have a much more likely chance to be healthy.
Okay, so toxicity is really important. Looking at the labels, very important, Dr. Gator. Thank you so much. The average woman puts like 196 chemicals and toxins on her face and her body by the time 9 o'clock comes. Where are the big toxins that people should be aware, of, and really look at in terms of the damage that it's causing on our body? And what are they? You've mentioned BPA. What are the other ones that are maybe the top three that you think, and where do they mainly come from?
Well, I think it's a good question that doesn't have a great answer, right? This is like the question, like, what is going on with chronic disease? What are the big 5 or the big 10 or the big 20? There are a lot of theories, but it's like whatever people are talking about this week, that comes out there. So I think, even bigger question is, we need to sit down, as countries, as the world really, and be like, all right, well, this is going on. Why? What are the big things that we need to be focused on? What are the 5 things that we need to do, the 10 things that we need to do to cut our risk? Like, I don't have a perfect answer for that. I have, kind of theories. And when I talk about it, it's like, okay, well, what do you do a lot of? You breathe a lot, right? So, maybe there's some chemicals and toxins in the air. So maybe you can get plants for that. Water, if you're drinking your tap water, maybe you can get a filter for something like that. Glyphosates, obviously, or weed killer, those are big ones. So I think minimizing your glyphosate is a big one. That's good that we're talking about it. Metals, lead's a big one, right? So make sure not to have lead pipes or lead paint in your home. I think that's well known. Sugar, but sugar's I think toxic in the way that we eat it. Sugar is not bad for you, right? We need glucose. It's important. We use it in our body. So sugar in and of itself is not bad. It's the amount of sugar that we're getting and the kind of sugar. Like you can eat fruits, you can eat your veggies. I think you can have your honey, you can have your like these things are okay, but we don't want to have the refined sugars, the high fructose corn syrup. We don't want to have grams and grams and grams of sugar poured down our throats every single day. We're getting more sugar every day than we probably need in a month for most people. So it's not sugar that's a problem. It's the way that we're eating it. So reading labels, minimizing that added sugar. Those are some of the big ones that I think of.
Great. And we've spoken a lot about detox protocols, not with children. So I'd love to hear, your view on the best detox protocols. We've got an infrared sauna, and I try and get our family in there. And sweating for me is, if you can't get an infrared sauna, just try and sweat as much as you can. I think getting outside and getting good sunlight without burning, trying to not use a sunscreen or use an organic sunscreen, but sweat as much as you can. Give us your top detox strategies that are both, practical, that are pragmatic for people to adopt. Because I think, we avoid as much as we can, but then we do need to detoxify.
Yeah. Detoxing for kids is a tough subject because there's not really almost any research on it, right? So it's really hard to know scientifically, like if there's specific supplements or products that we should do. We always want to be more careful for kids. You can use your common sense, but when I talk about detox, mostly, unless there's something very severe. So there's two scenarios, right? I think that's key. Like a child or an adult who has a very severe condition that you're trying to aggressively detox them because they're very, very sick in the hospital. I think that's different. We're not talking about that versus your child that's kind of your average child. You're working to get them a little healthier. You want them to do a detoxification. So to me, for a kid, you don't necessarily want to give them a ton of supplements. You don't necessarily want to give them a bunch of products because, that's not fun for kids and they don't want to do it anyways half the time. But we want to support their natural detoxification. And well, how do you get things out? Poop, pee, and sweat. So support that. I mean, that is the key. If you're doing a week or two, you know, get them moving, get them sweating. I mean, obviously you don't want to go for a long time in a sauna with a kid, but you know, they can be moving more. You can get them outside. You can put them in like a low, you know, if you do have a sauna, it doesn't be like super warm, but you can put them in there and sit in them for not super long, but they could do that if you want to. You want to make sure they're drinking a lot of fluids, like a ton of water. You want to have them detox, just get them peeing a lot more, get them pooping a lot more. Nobody poops enough anymore, right? So make sure we're getting our, you know, you want to give a supplement, like give some magnesium, get them going to the bathroom, a lot of fiber, a lot of fruit and veggies, like get them going a lot more so you can get things out. Like that is how you really detoxify your body. And for most part for kids, unless they're super sick, that's going to be enough of a detox. And that is usually what I recommend to start, unless there's something more severe going on, then we would talk about it. And you can do the, you know, some of the regular things like magnesium, vitamin C, vitamin D, those kinds of things. I think that's okay. But that you got to work with a practitioner to decide what makes sense for you.
Brilliant. If we can get into a little bit of functional medicine, you know, I haven't done a lot of studying in terms of kids and looking at numbers, but just knowing how important, you know, things like fasting insulin is, that's a huge key, because I think if people are, you know, getting into prediabetes or insulin resistance early, you know, those neural patterns of habits that are forming and just your body shape as you grow up and being obese when you're young. Do you have any markers that you look at specifically and the ranges? I mean, say fasting insulin for adults, I mean, we really look at trying to keep it between 3 and 5 of fasting insulin. We do run a very data-centric model here at the practice and my corporate business and Mate is Right. Do you have any markers that you're really looking at? Because I've just seen the numbers sort of just dramatically shift. I mean, even looking at, you know, GGT now, gamma glutamyl transferase, that those numbers, because we've got a sicker sample group, are just being pushed out, and discussed this a lot. But what does Dr. Gator look for?
So again, with kids, I think it's so different because we rarely, I don't do blood work that often. I mean, certainly we do the regular stuff, but with kids, it's such a traumatic experience to get all that blood. So certainly we do it sometimes, but I think that you have to be very mindful for kids that you don't want to send them through a ton of blood work and do a ton of functional medicine testing unless they're really, really sick. I think then parents are okay with it. But usually we're focused more on nutrients and supplements and herbs and changing up their diet and their lifestyle first. And that usually when we go in that direction, it's enough. I mean, certainly you can look at sugar, fasting glucose or sugar rates, which I think that can be really helpful. Sometimes people will get insulin, not insulin, glucose monitors and kind of see where their glucose is going, which I think can be really helpful. I don't usually look at a lot of that stuff at first. I mean, I think it's specific to the child, what we're going to be doing, but oftentimes what seems to be more helpful is stool testing. Stool testing can be really helpful to look into the gut, see what's going on, see if there's inflammation in the gut. I think that's pretty helpful for kids because usually that's, really easy to do. It's non-invasive, pretty simple. Sometimes you can do urine testing. I don't do it as often, but sometimes we'll do it. You can do metals testing so you get some hair. Like a lot of times for kids, I'm trying to think of what can we do without doing blood work.
Yeah.
So,
but I think also the dry
yeah.
blood spot analysis, because we've done the kids, a lot of the parents have brought their kids and then we do the DBS, the dry blood spot analysis. So looking things at amino acids and then looking at, you can get a vitamin D like that because, so many kids are just vitamin D deficient, especially the darker their skin is, they're vitamin D deficient. I think that's causing major problems with regards to sleep and major problems with regards to concentration. But maybe an omega test. I've never seen omega levels. We had Bill Harris on the podcast talk about, omega 3s, not getting them in the diet. I've seen that make a huge difference to mental performance. So your view on sort of maybe DBS and looking at omegas or the top supplements that you give that people, are not giving their children.
Yeah, well, I think vitamin D is correct. I think that's the number one, right? I think that's a very obvious one. Almost everybody's vitamin D deficient these days, so you almost don't need to test. At this point, I think it's good sometimes to have it just to show where the levels are. Omegas too. I mean, a lot of people are not getting their omegas and not getting them in the best form, so that's reasonable. I mean, I've done nutrient testing before. Oftentimes, it's off. But even for kids, I mean, even the recommendations now, even from a regular medical standpoint, are not to do vitamin D testing anymore because you're just like assuming. I don't think that's true. I think it's worthwhile to do it so that way you can look and see what the numbers are. But I mean, it's pretty obvious. Everyone's vitamin D deficient. We're not outside enough. So yeah, and I think doing blood spot testing, again, it's like if you can get the blood and it comes free flowing, great, but it's not super fun for kids. I've done food sensitivity testing before. Again, not like the best validity in kids, but it can be helpful sometimes to kind of see where things are off the chart, and maybe there are some foods that you can minimize. So those are the things that I often do. I mean, I've done food sensitivity, I've done stool testing, I've done nutrient testing. I've done a lot less of it lately, and more focus on lifestyle and health, and that seems to work better for kids than doing a bunch of lab testing. I think it's just really focusing on lifestyle. It seems to be what works best for families.
What do you think is best from a lifestyle perspective in terms of treating allergies? It just seems like every second child that I see has got some type of allergy. I mean, look at my daughter, she's dairy intolerant now, and she can't do any casein and can't do any lactose. And, there's just like dermatitis, eczema that I mean, it's just exponentially increasing. I just cannot believe how allergic people are to things. So what are your sort of top lifestyle interventions for someone's listening now to say, listen, I've just got allergies with my kids. I'm really, really struggling. They can't eat this. They can't go here. They can't touch this. From a baby perspective, and I know we can look at the sort of microbiome and skin microbiome, what do you think your sort of top 3 lifestyle interventions are?
The big one is food that I've seen, right? So I mean, I think that's true for everyone across the board. You ask any integrated practitioner, start thinking about what they're eating. I think the kids' guts are so mucked up with food, and the food is so crappy that we're eating. So that is often where we'll start the discussion. Obviously, if you're already know you're sensitive to gluten or dairy, that's not super helpful but I mean, a lot of times if we're talking about, like, let's say seasonal allergies or something like that, then people don't always connect what they're eating. But I have seen remarkable difference for families who start to focus on, okay, well, what are some other things that might be causing inflammation in the body? And if we can minimize those, then everything seems to be functioning a little bit better, and you see some, drastic improvements. So especially for most of the allergies, like dairy and wheat are the 2 big ones. We hear it all the time, but for whatever reason, those are just the 2, whether it's the glyphosate spray, the way that we're making it, the way that milk is these days. I don't know what the reason is, but at the end of the day, for whatever reason, the ones that we're getting seem to be super inflammatory for most kids, and they just can't handle it anymore. So getting those out usually seems to be very helpful. A food diary seems to be really helpful too. So kind of writing things down. A lot of times it's detective work, and I talk to parents all the time. It's not always so easy to figure out what you're sensitive to. I mean, you can do a food sensitivity test. It might be helpful, it might not. But what seems to be the most helpful is a detective parent who over time kind of thinks about, what's going on, what made things worse. If you have eczema, that's a good example. Okay, when did it flare up? What did you do that day? What did you eat that day? What did you eat the day before? And the vast majority of the time, it's not obvious. It's not so obvious until the parent starts to think about it, and then they do it over, it might take a year, it might take 2 years, but they come back and they're like, you know what, I figured it out. Every time we eat tomatoes, things get worse. Oh, I figured it out. Every time we go to this playground, it gets worse. Like maybe that place was sprayed. I had a kid, maybe like half a year ago, was just so interesting. Like they had this really bad eczema and they could not figure out what it was from. And they switched schools and it went away the next week. And it was just gone after that. And it was like, okay, well, probably they sprayed something at that school, or maybe there was mold, or I don't know what, like something there, but like something drastic like that. So it's not always obvious. I think the best way to figure things out is to be a detective, keep thinking it through, keep being persistent, keep writing stuff down, because hopefully over time you can figure out a pattern. And that is the number one thing that seems to work. It's not the doctor, it's not me half the time. I mean, yeah, sometimes we can do a test and figure something out, but the tests only get you so far, especially in kids. The parents are really the ones that usually figure it out. And I try to give encouragement to parents that most people do figure it out. Most people do over time figure out the big triggers, not everything, but they figure out like, oh, it was this thing, or it was the dog, or it was, whatever. Like it's not so obvious for everybody, but if you can minimize those inputs of inflammation for you, then your body gets a chance to reset, and then things seem to be much better. Like a lot of kids with food sensitivities, they don't have them when they're older. Even though they had them when they were younger, their body resets, they get a little older and stronger. I don't know what happens. Maybe their microbiome resets, or just because it's different when they're a few years older, but it gets better. So I think it can if you stick with it. But yeah, I think just being focused, keeping a diary, being aware, trying to decrease inflammation. So there's a lot of supplements out there that are good for decreasing inflammation. We mentioned a bunch of them already, like omegas, vitamin D, D-Hist Junior is a great one for kids. It's a very popular antihistamine support. So these are things that parents do, but there's no one size solution for any of this stuff.
Brilliant, Dr. Gates. I really, really appreciate that. Your seed's well-being starts with stress, and I've just seen, the amount of stimulation that our new generation, Gen Alpha and Gen Z, are going through. We say at the tribe here at Made to Thrive that someone's receiving the stimulation in one day that someone in the 1400 received in their whole lifetime. There's constant devices that are there coming from the schools. And so tell us maybe you got some stats on how stressed our, new generation, Gen Z and Gen Alpha are, or how you manage screen time, because that's another sort of area in our family. We try and do a digital sunset once a week. It hasn't been easy. 5 o'clock comes, we switch off. We all switch off. I'm in the process of going to be doing a reel now, Instagram reel, YouTube video. I'm going to go and buy a second phone that only very few people have got, so I can just switch off and my patients can't get hold of me. And it's just trying to manage this digital world. Give us probably some, a structure or frame with regards to devices and children, maybe just so speaking to that SEEDS wellbeing, because I think it's a really nice acronym.
Yeah, well, let me start there then. So, for the book, Parenting at Your Child's Pace, the reason why, the two big reasons why I wanted to write the book were, number one, I think parents are more stressed than ever. I've seen that more and more, and I feel like there's just so much information out there, and it's really hard to know what to trust, what to do, and you always have different people telling you different things. Like 50 years ago, you wanted to start feeding your kid. What do you do? Oh, yes, grandma. Oh, I started peas at 6 months. Okay, let's do that. Right now, grandma tells you something, your other friend tells you something, the influencer tells you something, the internet says if you start peas, it's going to kill your child. And then you're like, I don't know what to do, right? So everything is so contradictory. It's so stressful. So I wanted to write a book that kind of goes through some of the big questions that I get consistently, and really tries to help parents to think through these things, because there's no one right answer to almost anything. You have to figure out what makes sense for your child and synthesize the data and then figure out what makes sense for you. So that's where Parenting at Your Child's Pace, the name, comes from, is figuring out what makes sense for them. So that's kind of one aspect. Second aspect is health, right? I mean, parenting books don't generally talk about health and wellness at all. They're usually written by therapists or other people these days that don't have a medical background. And so I really wanted a book that focused also on health. So it goes through the big parenting questions, but starts with the foundations of health, because there really isn't any books that do that. And when I went to pediatrics, and I think most pediatricians go in, they want to help kids. They want to prevent disease. And that's not what we're doing anymore. We're treating disease. And so I wanted to get ahead of it and write a parenting book that gets to parents before their kids develop anything. And so that's where the SEEDS acronym comes from, the foundations of health being stress, environment and toxins, exercise, diet, and sleep. So a lot of the stuff we already talked about. So that's where that foundation comes from. So that's kind of the first part of your question. The second part of your question about screens, I think that's a big topic. I think it's an important topic. I'm really glad this year that it's really come out to the forefront as something that has been talked about a lot more. Jonathan Haidt's book really, I think, brought it up, which is fantastic. Yeah. There's a lot of discussion around taking phones out of schools, which I think is good. In Los Angeles County, they are, stopping phones, and a lot of other places are doing it. So I think that's good. I think we're moving in a good direction. I think that screens are extremely stressful for our kids. I'm not an all or none type of person. I don't think that screens are going anywhere, so I think it's okay. But at the end of the day, they're on it way too much. I mean, we know that the average teen is on screen 7 to 9 hours a day now. So it's not that you watch a screen and it turns your brain to mush, but if you're on a screen for 10 hours, what are you not doing? You're not getting outside, you're not moving, you're not socializing, and that's what we're missing. So I think that we need to focus on bringing that number back down to something more reasonable. If your kid's on screen for an hour doing homework, that's not what I'm worried about. If you're watching a TV show or something, we all did when we were kids, I don't think that's what I'm worried about. It's like just being on there all day, being on social media all day, being stressed all day, because, social media now is very stressful. Everything's a headline and meant to scare you, meant to make you angry, and adults can't handle that. So certainly teens can't. And so I just think that it's all of our job now to kind of push back a little bit and kind of move things back to a more balanced place. We're not that, you never on there's no more social media, no more screens, but like we're not on it all day. You're not on it in school. You can't focus in school if you're looking at social media. I mean, there's no, it's so obvious. It's like, yes, you don't need to be on your phone at school. You want to have access. Okay, you can have a flip phone in case there's an emergency or something, but you don't need to be checking your social media. A 12-year-old doesn't need social media. So I think we can push that age back, and we are, which I think is good. Every study that I've seen shows that you removing these things from schools, everything improves, academics improve. A lot of European countries like Finland, Sweden, I think already have already taken these out of schools, even just in last year. And all the numbers show improvement, like less visits to the counselor, less mental health issues, better scores at academia, better testing, like everything is improved, which obviously it is because you can actually pay attention. So I mean, that's not rocket science. I think that's fine. I think that's a good thing. But I think as a parent, like you mentioned, being okay with, again, setting some boundaries, reasonable boundaries. I think that's a good thing, and that's going to be helpful to our kids. No screens first thing in the morning, no screens in your room at night, no screens after 8 o'clock or 10 o'clock or whatever it is when they're going to bed. Out of your room, away from your head, no screens at dinner. These kinds of things make a big difference, just to decreasing that amount of time so that you're socializing. And I think if we do that, that's probably enough, and that'll be fine. But I would focus on the 7 to 10 hours a day that kids are on screens, not that they're watching a movie when they're on a plane or on a car ride or doing your homework. Like, that's not the issue to me.
Okay, great. In terms of the exercise, do you have any sort of programs that you put kids through in terms of aerobic, anaerobic, doing like push-ups or air squats? And do you have any sort of framework? And then secondly, is it, I went and did a presentation at my high school. It was really well received, about getting some type of wearable and looking at sleep and looking at how much movement you're getting, because people are just so unaware and they don't realize, oh, you're on a screen, now you're studying, now you're writing exams, and all of a sudden you go for your hour exercise, and then you're getting 4,000 steps a day. So do you have any sort of specific recommendations there with regards to exercise and movement?
Yeah, well, I mean, the first thing is just to be aware of how much it matters, right? I mean, it's like that's gone out of our minds. You look at the blue zones around the world, the places where people live the longest, and they're moving all day, every day. They're not going to the gym. They're not doing anything magical. You look at the grandmas, they're like 95 years old and they have bigger muscles than we have. They're just in the kitchen, like, rolling and working. The people are outside at the farm. Like, that is what gives you true health. It's just moving all day. You don't have to go to the gym. If you want to, that's great. But just being focused on moving more, I think, is the first key. So just finding ways within your daily routine where you can get more steps. So whether that's being dropped off a couple of blocks from school and walking together, maybe parking at the back of a parking lot instead of the front, taking the stairs instead of the elevator, like anything that you can do to increase those steps matters. And the research is very clear on this. And you look at any study that looks at steps, and your risk of every sort of condition and death goes down significantly, like 50%, 90%, if you just get 7,000 steps a day, 10,000 steps a day, not anything crazy, like just moving a little bit more. So I do think, if it's something that is helpful for a patient, like just getting some sort of wearable or something you can put in their pocket, like a step counter, even something just as minimal as that, so they're just a little more focused on let's see what you're actually doing. Sometimes just wearing it or having it, or even looking at your phone if they have it, and looking at the counter, just be like, oh, I'm only getting 4,000 steps, I'm only getting 2,000 steps. Like, okay, maybe I can get a little bit more. And that those are like very basic things where you just make someone a little bit more conscious about it, and that way they are moving a little bit more. Because I don't think it's very easy to get everyone to go to the gym, nor should we. I think it's fine if you want to, but to me, again, it goes back to, we have to build a lifestyle for success. So we have to build our life around movement, not try to get our kids to just go to some activity for 1 hour a week, and that's what's going to do it. I mean, that's great, that's fine. You want to put your kid in soccer, wonderful. That's good too, but that's not the sustained low level movement that I think really is the big part of health. Where you look at, again, the blue zones, they're not doing anything specific, they're just moving all day, that's just their life, and that's who lives the longest. We don't need a study for that, you just see it. So I think that's what you want to build into your kid's life, is just, how do you foster movement as a family? Like, let's go on hikes, let's go outside, let's go on a walk after dinner as a family, like whatever you can do, whatever makes sense for your family in your neighborhood or wherever you are, like just build that into your day, so that's just a part of the day. And if you can get an extra 2,000 steps by going for a walk with your family for 20 minutes or something, like that might be enough.
Yeah.
That might be enough. It doesn't have to be rocket science.
Yeah, cool. This is sort of a personal question. I've just seen it now, and sort of the data confirms it, that in the last 20, 30 years, free testosterone has decreased by 45%. And, the millennials and Gen Z generation, in terms of testosterone, are sort of the weakest that we've ever seen. Never mind sperm morphology and structure and motility and just number has gone down dramatically, 50%, I think, in the last 50 years. But it just seems like if someone's listening out there, this estrogen dominance, and then, women that are getting their period now are taking the pill straight away, or they're taking the contraceptive pill. Maybe you've got some nuggets in a frame, just because I just think we've got a hormonal dysregulation pandemic that I've never seen before. And it's difficult with the amount of, xenoestrogens out there from plastics, and to avoid them, and to detoxify from them. Do you have sort of some type of frame with regards to, a 12-year-old who's getting their period and going through menarche, doesn't take a contraceptive pill, and tries to use lifestyle? Or how would you put this from a pediatric perspective?
Yeah, I mean, it's like you're hit on a good point. That's really quite insane. If you look at the numbers for puberty, 8 or 9 is normal now to start puberty versus 12 or 13 when we were born. And so that's a pretty big difference over just a few decades. I don't think we know why, not for sure. I think we have a lot of theories. And once it started, it's probably a little bit late at that point in terms of changing in terms of puberty. But I think we have a bigger conversation around why this is happening in society and trying to figure out what we can do. I mean, to me, you hit on the big ones. I mean, I think the two big things are you have the estrogenic toxins and chemicals out there, like plastics, which we have a pretty good sense are estrogenic at this point. And you look at things like the pesticides and the plastics, and some studies show in animals that you can feminize male rats and other things like that with some of the like atrazine. So I think that's going on to some degree. And then you also have the obesity epidemic as well, which can convert testosterone to estrogen as well. So those two things together, I mean, I think we're pushing things over the edge at this point. And so the two big things that you can really do are just think about those things, try to minimize the plastics and anything that we might be aware of that could be estrogenic, and then exercise. I mean, moving, eating healthier, and trying to decrease that midline fat are really huge factors in helping that. And those are the things that we have some control over. So I'm not sure that we have a lot of control over everything else, but to whatever degree we can, we're not cooking in plastic, we're not keeping our food in plastic, we're not warming things in plastic, you're not drinking out of plastic as much as you can. And then I think you at least minimize that to some degree, because we're just so full of microplastics. I mean, all the studies, like all the testicles have plastic in it. The brain has 1 to 5%. I've seen recent studies that have microplastics in it. It's in everything. It's in babies and fetuses and placentas. It's all over the place. So the more that we can reduce it, the better. It's not going away, but at least you can minimize whatever you can. You have some control over, and again, whatever you can do, hopefully that's enough.
Brilliant. We've come to the end of the show. Possibly you can give a strong message of hope, and summarize it. We've looked at the stats, and just, you speaking about what's happening to plastics and toxicity and where it is. I'm just thinking, oh my goodness, it's just a horrible state of affairs out there in terms of fighting big food and big telecommunications and big agriculture. It's really, really tough, and we need communities around us to help us, and families that can come together, and probably different type of schools that only serve this type of food, and don't have ultra processed food. But maybe you can summarize from Dr. Gator, and I just want to just commend you on your courageous calling to write a book like this, to speak out there and to take the time, and being open-minded, because there's not many pediatricians, especially in our environment here in Johannesburg in South Africa, that are really open-minded. But a message of hope for parents and children that possibly are listening.
Yeah, well, I think it's very hopeful. I mean, there's a lot that's going on, but number one, keep in mind that you as a parent, as a family, have the most control over your own family. And so if you do take some simple steps, that's probably going to be enough to keep your family healthy. My patients have a very integrative minded patient group, and they're pretty healthy compared to what I've seen working at the hospital and other things. And not because I'm some magical doctor, but because they're just a little bit more integrative minded. So I think if you are aware of this stuff, that gets you a long way in terms of making the decisions that are going to be a little more health conscious for your family. And again, our bodies are amazing, so we can do a lot of detoxification, and the more you minimize what it's exposed to, the better. We're for sure talking about this stuff a lot more now. It's out there. I mean, it's not mainstream maybe totally yet, but it's certainly becoming more mainstream. So I think everybody just continuing to talk about it kind of pushes the needle. There are a lot of people that are holistic minded, and the more we band together, the more that things are going to change. Start with your own family, and then we'll continue to build out. And don't be afraid to reach out. Be the weird parent that gives your kid the snack. That's fine. Like, you want your kids to be healthy. You don't want your kids to be 1 out of 2 with a chronic disease. You do what we know is healthy and what worked forever. And just have confidence in that. There's so many health conscious parents out there, and people will catch up as they start to see people being a little more healthy. They'll do it. Like you mentioned acupuncture, we can finish on that. Like that was woo-woo just a few years ago. Then you have opioid epidemic, and then we don't want to use opioids anymore. And so acupuncture is in every hospital now. Like things are coming full circle. There's nothing woo-woo or crazy about eating healthy and exercising and getting sleep and decreasing your stress. So don't feel like you're the woo-woo parent. You're the very normal parent, and everyone else is just going to have to catch up.
Yeah. Brilliant. Well, I want to declare favor and blessing over you, Dr. Gator. Thank you so much for your time, just your practice. And 48% of our listeners are in the US. So maybe we will put it in the show notes, but maybe just mention people where they can find you.
Yeah, you can find me on Instagram at Dr. Joel Gator, or on X at Dr. Joel Gator, or you can get the book Parenting at Your Child's Pace on Amazon, or anywhere you can get books, or parentingatyourchildspace.com.